Reaching the age of 50 is a major milestone. It often comes with greater wisdom, deeper life experience, and for many an increased awareness of personal health. But for those living with diabetes or at risk of developing it, turning 50 can also mark the beginning of a more complicated phase of disease management. Diabetes is not just about high blood sugar. Over time, it silently affects multiple systems in your body, and after 50, the complications can become more severe, more dangerous, and even life-threatening. In this comprehensive guide, we'll explore the most dangerous complications of diabetes that commonly arise after the age of 50. We'll explain how they develop, how to recognize early warning signs, and most importantly, how to prevent or manage them effectively, whether you are living with diabetes, care for someone who is, or simply want to understand the risks. This article is essential reading. After 50, your body undergoes a range of physiological changes. Your metabolism slows down, your muscle mass may decrease, and your body's sensitivity to insulin may decline. These age-related changes make it harder to regulate blood sugar levels effectively. Many people also begin to experience other health conditions like high blood pressure, high cholesterol, or heart disease conditions that complicate diabetes management. For women, menopause can significantly alter hormone levels, further impacting blood glucose control. For men, testosterone levels may drop, which is also associated with insulin resistance. Type 2 diabetes, in particular, becomes harder to manage with age. Medications may need adjusting, and dietary habits often require stricter discipline. The margin for error becomes much smaller after 50. A poor meal or missed medication could result in dramatic blood sugar swings that increase the risk for serious complications. Why complications are more dangerous after 50? There are several reasons why diabetes-related complications become more dangerous with age. Slower healing. Aging slows down the body's ability to heal. Aching. Even small wounds more susceptible to infections. Weakened immune system. Your immune response weakens, making it harder to fight off infections. Reduced circulation. Poor circulation due to aging and diabetes increases the risk of ulcers, gangrene, and amputations. Coexisting conditions. High blood pressure, high cholesterol, and obesity are common in older adults and magnify the complications of diabetes. Delayed symptoms. Older adults may not experience the classic symptoms of complications, delaying diagnosis and treatment. These factors create a perfect storm, making early detection and proactive care even more critical. Cardiovascular complications. Heart disease is the #1 cause of death among people with diabetes, and the risk escalates significantly after 50. High blood glucose levels can damage blood vessels over time, leading to coronary artery disease (CAD), heart attacks, congestive heart failure, peripheral artery disease (PAD). Symptoms like chest pain, shortness of breath, and fatigue may signal a heart issue. However, many older adults with diabetes don't feel these symptoms as strongly. That's why regular cardiovascular checkups including ECGs, cholesterol tests, and stress tests are crucial. Preventative measures include a heart-healthy diet low in saturated fats, sugars, and sodium, regular physical activity, and managing stress. Medications like statins or ACE inhibitors may also be prescribed to reduce risk. Kidney damage. Diabetic NEPHROPATHY closing parenthesis. Your kidneys filter waste and excess fluids from your blood. High blood sugar can damage these filtering units, leading to diabetic nephropathy, a condition that affects nearly 1/3 of people with diabetes. Symptoms of early kidney damage are often silent. By the time swelling in the legs, fatigue, or high blood pressure appears, the condition may already be advanced. To catch it early, doctors recommend annual urine tests to check for protein albuminuria, which indicates kidney stress. blood tests to measure creatinine and estimate glomerular filtration rate (eGFR) are also key. Managing blood sugar, controlling blood pressure, staying hydrated, and avoiding nephrotoxic medications like NSAIDs can slow or prevent kidney damage. Nerve damage. Diabetic neuropathy. Diabetic neuropathy affects up to 50% of people with diabetes. It occurs when prolonged high blood sugar damages the nerves, particularly in the legs and feet. Common symptoms include tingling, numbness, or burning sensation, muscle weakness. Loss of coordination. Sharp pains or cramps. Left untreated, neuropathy can lead to serious foot infections, ulcers, and even amputation. Foot care becomes essential. Inspect feet daily, wear proper footwear, and see a podiatrist regularly. There's no cure for neuropathy, but good glucose control, physical therapy, and certain medications like gabapentin or duloxetine can reduce symptoms and prevent progression. Eye complications. Diabetic retinopathy. Diabetes is a leading cause of vision loss in adults over 50. Chronically high blood sugar can damage the tiny blood vessels in the retina, leading to diabetic retinopathy. Glaucoma. Cataracts. Macula or edema. Early stages may not show symptoms, but as the condition progresses, you may notice blurry vision, floaters, or even sudden vision loss. Annual dilated eye exams are essential. Treatments like laser therapy, anti-VEGF injections, or surgery can preserve vision if caught early. Foot complications and amputations. Foot complications are one of the most feared outcomes for older adults with diabetes. Poor circulation and nerve damage create a high-risk environment for infections and ulcers. Without pain signals to alert them, individuals may overlook small injuries that worsen over time. Left untreated, minor wounds can become infected, and severe cases may lead to gangrene and amputation. In fact, diabetes is the leading cause of non-traumatic lower limb amputations. To avoid this, daily foot care is vital. Always check for blisters, cuts, redness, or swelling. Wash and dry your feet thoroughly, moisturize but not between the toes, and avoid walking barefoot. Annual visits to a podiatrist are recommended. Cognitive decline and Alzheimer's disease. Emerging research links diabetes with an increased risk of dementia and Alzheimer's disease. High blood sugar, insulin resistance, and inflammation may damage brain cells and reduce cognitive function. Signs of cognitive decline include memory loss, confusion, difficulty concentrating, and changes in mood or personality. These symptoms can be subtle at first but may worsen over time. Managing diabetes effectively through blood sugar control, heart-healthy diets, mental stimulation, and regular physical activity can help protect the brain. Some experts refer to Alzheimer's as type 3 diabetes due to its strong metabolic links. Skin conditions and infections. Older adults with diabetes are more prone to skin problems, ranging from dryness and itching to fungal and bacterial infections. High glucose levels can impair the skin's ability to stay hydrated and heal properly. Common conditions include diabetic dermopathy, fungal infections like athlete's foot, bacterial infections such as styes or boils, itchy skin pruritus. Keeping skin clean, moisturized, and checking for any abnormalities daily is important. Seek medical attention for any cuts, sores, or rashes that do not heal quickly. Hearing loss. Research shows that people with diabetes are more than twice as likely to experience hearing loss compared to those without. High blood sugar can damage the small blood vessels and nerves in the inner ear, leading to gradual hearing decline. Signs include needing to turn up the volume on the TV, difficulty hearing in noisy environments, or frequently asking others to repeat themselves. Hearing tests should be done regularly after age 50, especially if you notice changes. Blood sugar control, avoiding prolonged noise exposure, And early use of hearing aids if necessary can help preserve hearing. Sleep disorders and fatigue. Diabetes and aging both contribute to poor sleep. Sleep apnea, restless leg syndrome, and frequent nighttime urination are common among diabetic individuals over 50. Poor sleep worsens insulin resistance and blood sugar control. Fatigue also increases the risk of falls and injuries. Digestive issues. High blood sugar can damage the vagus nerve, which controls digestion. This can lead to a condition called gastroparesis, where the stomach empties slowly. Symptoms include bloating, nausea, vomiting, and unpredictable blood sugar levels. Smaller, more frequent meals, limiting fat and fiber intake, and medications like metoclopramide can help manage this condition. Urinary tract and bladder problems. Diabetes can lead to nerve damage affecting bladder control. This may result in urinary retention, incontinence, or recurrent urinary tract infections (UTIs). Symptoms include urgency, pain during urination, or incomplete bladder emptying. Increased risk of infections and slow recovery. After 50, people with diabetes face higher risks from infections such as pneumonia, influenza, and COVID-19. Recovery from illness or surgery is often slower due to impaired immune response and circulation. Vaccinations. Flu, pneumonia, shingles, COVID-19, prompt treatment of infections, and close blood sugar management are essential to reduce risks. Practical tips for managing diabetes after 50. Now that you understand the dangerous complications that diabetes can cause after age 50, the good news is many of them can be prevented or at least delayed with the right actions. Here are key strategies to protect your health. Monitor blood sugar regularly. Use a glucometer or continuous glucose monitor to keep your blood sugar in check. Know your target range and stay within it. Prioritize routine checkups. Visit your doctor, eye specialist, dentist, podiatrist, and other healthcare professionals at least once a year or more often if advised. Eat smart, not just less. Focus on whole grains, vegetables, lean proteins, healthy fats, and foods with a low glycemic index. Avoid refined carbs, sugary snacks, and processed foods. Stay physically active. Even moderate exercise like walking, swimming, or yoga can dramatically improve blood sugar control, mood, and cardiovascular health. Take medications seriously. Whether it's insulin or oral medications, consistency matters. Never skip doses, and talk to your doctor about side effects or changes in your condition. Get vaccinated. Stay protected from influenza, pneumonia, shingles, and COVID-19. These infections can be far more dangerous if you have diabetes. Watch your feet and eyes. Daily foot checks and yearly eye exams can catch problems early before they become severe. Limit alcohol and quit smoking. These habits raise your risk for nearly every diabetes complication. Quitting is the most powerful decision you can make for your health. Stay informed. Knowledge is power. Stay updated on new treatments, technologies, and lifestyle tips that can improve your quality of life. Your future is still in your hands. Turning 50 is not the end, it's a powerful new beginning. Diabetes becomes more challenging with age. Yes, the complications are serious, and in some cases, life-threatening, but that doesn't mean you're powerless. In fact, the opposite is true. Every healthy meal, every walk you take, every doctor's visit you attend, these are investments in your future. Living with diabetes after 50 doesn't have to mean living in fear. It means living smarter, more intentionally, more aware of your body, your choices, and your potential. Thank you so much for joining us on this important journey through the hidden dangers of diabetes after age 50. If you've made it this far, it means you truly care about your health or the health of someone you love, and that alone is a powerful step toward lasting change. If this video helped you or inspired you, please subscribing, leaving a like, or sharing it with someone who needs this information. Your support helps us create more valuable content that empowers people just like you to take control of their health. Thanks for watching. See you in the next video.